I'm Dr. Malik, intensive care specialist. We frequently get patients with hiccups. This is what is hiccup. So frequently we get these patients almost every alternate day, every day. Sometimes they say that since night they are continuing. It is not just 1 hour or 2 hours. Since night they are continuing. They are not coming down. It is continuous. Hiccups. Hiccups are very, very, very common. Very, very common. Usually they come down on their own. Usually after some time, some people take some cold water, etc., etc. It will come down. But sometimes they don't come down with anything. With home remedies, they don't come down. Then they come to the hospital. They come to the emergency department with these hiccups, continuous hiccups, continuous hiccups. What is exactly a hiccup? What is exactly a hiccup? We should understand. See, these are our lungs. See, this is our larynx. This is our larynx. We breathe from this place. See, this is our larynx. This is our larynx, and these are the vocal cords. These are the vocal cords. Here, from here we speak. This is our larynx. Larynx, after going down, it splits into bronchi. These two are the main respiratory tubes. Main respiratory tubes. This is larynx. This is vocal cords from where we speak, and this is right lung, and this is left lung. This is left lung, and this is the diaphragm. I was telling you, what is diaphragm? Diaphragm is a thick layer which separates the chest from the abdomen. This is the stomach. This is the stomach, liver, right lobe of the liver, left lobe of the liver, lung, stomach, intestines. But there is one layer. This is a big layer. This is a very thick layer which separates thorax, that is lungs, from abdomen. So what happens? What happens during a hiccup? What happens during that is hiccup is this gets stimulated. There is stimulation of the diaphragm. This diaphragm gets stimulated. It becomes overactive. Not only diaphragm. You have ribs. And between the ribs there are some intercostal muscles. There are small muscles which connect the ribs. They also are overacting. So diaphragm gets irritated. This is called diaphragm. Diaphragm gets irritated, and intercostal muscles, that is muscles between the small intestine. These are all the what do you call is chest ribs. So in between the ribs there are small muscles called intercostal muscles. They also become overactive. They are also overacting. This particular diaphragm is also overacting. So this is the reason for your hiccup. What happens during a hiccup is, see, the diaphragm and intercostal muscles are irritated. What exactly happens during a hiccup is, you get an inspiration, and then suddenly there is closure of the larynx. Okay, you take a good breath, and there is closure of the larynx. So this is what happens during a hiccup, and that is the reason. You take an inspiration and this closes. This is the pathophysiology of hiccup. This happens. Usually the hiccups, they don't last for more than 48 hours. Less than 48 hours, that is less than 2 days. Less than 2 days, if hiccups are there, we call them as benign. Benign means harmless. Usually, number one, it happens after taking a stomach full biryani and having some Sprite, cool drinks, etc. See, this is irritation of the stomach. Basically, irritation of the stomach, fullness of the stomach. You have a good meal with some biryani, etc., and then you have some cool drinks, some carbonated drinks, Pepsi, etc. After that, you start developing hiccups. Number one. Number two is, of course, this is the main reason, and there are some reasons. There are some other reasons called, suppose somebody is taking dexamethasone. Dexamethasone is a drug which can cause hiccups. This is drug induced. Suppose for some reason you are taking dexamethasone, it can also cause hiccups. Okay, the tablets are known as Vizolone or Omnicortel, that is dexamethasone. That also can cause hiccups. And aerophagy, smoking. What is aerophagy? Aerophagy means you are engulfing air. You are engulfing air. Engulfing air means you are swallowing air. You are swallowing air. Aerophagy. That means when does it happen? It happens usually with chewing gum, when you are continuously chewing gum, or you are smoking. During smoking also you are engulfing lot of air. So usually these are the small things. How do you see if it is benign? If it is simple benign, and that means it is lasting only for some time, that is below 48 hours. Simple maneuvers like stopping your breath for some time, 5 to 10 seconds, hold your breath for 5 to 10 seconds, so that carbon dioxide increases in the body, and hypercapnia. So carbon dioxide retains in the body, and again it becomes normal. 5 to 10 minutes of closure of the, take a deep breath and stop. It stops usually small procedures like this will stop. Sometimes give a very cold water, just take very cold water, and try to gargle. Your larynx and pharynx get stimulated, and it stops. These are some of the Valsalva procedure. We call it Valsalva procedure, holding the breath for some time, 5 to 6 seconds. There is a procedure called Valsalva maneuver. These are small things. Suppose they are not coming down, there may be some other causes. Which are called intractable causes. Intractable causes means there is some reason behind it. What are the reasons? Intractable, call it particularly in there is any renal problem, that is renal failure. Particularly in renal failure, this problem can occur. It will last more than 48 hours. That means it is intractable. More than 48 hours to 1 week to 1 month, it can be there in renal failure. And number 2, in chemotherapy, any malignancy with chemotherapy can lead to, any malignancy means any cancer with chemotherapy can lead to this problem. And there are diseases like multiple sclerosis. Okay, forget about that. They are all pathologies. And one thing is, suppose the patient is taking dexamethasone and having it, change the drug to methylprednisolone. Simple. If somebody is taking something called solumedrol, etc., methylprednisolone, so please change the drugs to dexamethasone to methylprednisolone. Okay. And there are some other drugs. Suppose it is more than 48 hours, or it is very problematic to the patient, you have some very good drugs called PPAs, proton pump inhibitors. There is one tablet called baclofen, is an excellent medication. Baclofen, which is also a muscle relaxant, it relieves very well, 5 to 10 milligrams 3 to 4 times a day. Baclofen is very good. And the other drug is metoclopramide. Metoclopramide is very good. That is Perinorm, tablet Perinorm, or injection Perinorm is very good, 3 to 4 times. Or there is excellent, if there is neurogenic cause like stroke, suppose the patient has got some CNS problem, the central nervous system problem like strokes also, in cerebral stroke also, that is like paralysis, cerebral strokes also, hiccups come, though they respond to gabapentin. There is one drug called gabapentin, 100 to 400 milligrams, 3 to 4 times daily, like that, gabapentin. And so there is another important drug called largactil, chlorpromazine. Chlorpromazine is another drug which is given in 25 milligrams 2 times or 3 times a day. This is also a very important drug. It is available as tablets and medication. So usually hiccups are below 48 hours are very benign. That means it has got no good reason, no big reasons behind it. But more than 48 hours to 1 week, definitely you should evaluate the patient. You should search the patient for any renal problem, any malignancy, like that, other problems, other stroke, etc. And if it is more than 1 month, it should be taken very seriously, and you must evaluate the patient for all these problems, renal problems, chemotherapy, any malignancy anywhere, chemotherapy, etc. All this, you must evaluate the patient. But usually